The next thing we're going to talk about is how to respond to typical client questions during sessions. There's usually about a handful of things that will be asked. Probably the most likely question is, how long will it last? So if you could imagine that your client has been through all kinds of different methods and modalities, and you know, those particular methods, if they had worked, then they probably wouldn't be coming into you. It's going to take some sort of training in their mind and actual proof from you in your session to show them that you can actually resolve pain, sometimes permanently, most of the time permanently with us, that you can resolve that pain within as little as 5 minutes, and usually within one session. That is our goal. So this question, how long will it last? Usually how we answer that is it should last forever if it's something that can be resolved completely. There are times where there's just a restriction in the fascia, and if we get the fascia and the fluid away, that one link in the chain, once it's removed, then it's gone forever. We've had clients that have come in that have had lower back pain for 30 years and nothing else has ever worked, and within one session it was gone, and it never came back after that. So it is possible that it will last forever, but that's not always the case. It's good for you, for Healer Logic, to know that based off of each client situation, what is one of those things where you're just, if there's a chain of events that happened from age 30 or 30 years ago when they were in high school and they had this back problem, it's good for you to know that there's a progression of things that happened with their lifestyle that led them up to now they have chronic pain. And you might remove one link of that long chain of events, and that one link is the last link that caused pain to happen over long periods of time. But then you only just kind of rolled back the time and removed only one link, and their lifestyle is still the same. If there's causes and triggers that may be environment, it may be things they're breathing in. Dust and mold are probably two of the biggest things with head and neck and respiration. That how long will this session last? It really depends on what the cause and the trigger is. If it's something that can be removed permanently, as far as a fascial restriction, then it could last forever. That is our goal. But again, it's good to know that if this person is in a condition to where you're just removing one link in a long chain, then it could last until tomorrow morning. If they go to sleep at night and they're in an environment with a lot of dust and mold, and there's mold in their house, then they're probably going to get back up to a certain condition probably overnight. It's going to mess them up even more, but it's probably not going to put them at the same condition and pain and those sorts of things than when they came in and see you. Usually what happens with those sort of things like head and neck, fluid pressure in the head, that we bring it back like several links, and then it slowly builds back up over time if the lifestyle doesn't change. So it's really part of your Healer Logic to know what this session is going to do for them, and of course over time you're going to be able to see a pattern with the clients that you have. Checking in with your clients, see even if they don't come back, are they not coming back because they're healed and it's just their condition is no longer there, or are they not coming back because they're in pain and they can't afford to come back and see you? Those things are good to stay in touch with your clients, to know these things even if they don't come back. That way you know how long it's going to last, because as far as you know, it lasted forever if that client never comes back. You may have a question, what do I need to do so this doesn't come back? Now you're into this discussion with your client about what were the causes, what were the triggers, what is the lifestyle things. And when I say lifestyle, I'm really talking about what is the air they're breathing in, what's the things they're ingesting, what are they eating, what are they drinking, what's your sedentary lifestyle versus actually exercising, those sorts of things, lifestyle choices. That can even be as much as based off of their occupation, they sit down all day. Based off of what side of the couch they sit on, they lean to the left. Based off of that they're driving all day long, so now they have edema in their leg, because in their right leg more than in their left leg, because they have to have their one leg on an accelerator. What side of the bed do they sleep on? You'll even start to realize whether they're a left side sleeper or a right side sleeper just by the condition of their neck. And so what do they need to be doing so it doesn't come back really is about changing the patterns, the lifestyle patterns, so that whatever brought them up to that point, they can try to avoid those things. Again, whether it's making sure that if there's a dust allergy, that's heavy dust allergy, that they do something like an air cleaner, or clean their house, or sleep in an area where there's not a lot of dust. Things that they eat, they may want to avoid certain foods. We see this all the time with our clients. And so just have a discussion with them on things you suggest or things you have seen as patterns. Your clients will be able to feed that information back to you. I cut out gluten and now I don't have these problems, and you'll be able to see those things over time, those patterns. Where does it go? That might be another question you get. That usually is dealing with our fat burning sessions, and when fluid leaves, like we do our head and neck flush for fluid, where does that fluid go, and you know what's going on with these sessions. The fat burning session really is the ability of losing diameter inches on certain diameter parts of your body, or body sculpting, and just removing. Usually what we're doing in a fat burning session is we're not only removing fluid, the phosphorestrictions that are keeping the fluids in there, but we're also releasing some of the triglycerides or the lipids inside of the adipose tissue, your fat tissues. So that's actually being released back into your system as well, and that usually gets eliminated by your elimination system. Or it just some of it actually, with the fat burning process, some triglycerides are actually expired or breathed out. But usually we see that there's some of it that has been through your elimination system, especially down when it's in the lower abdomen as well. The fluids that we push in from one section to another, like head and neck, when we put it down into this area, we do our fluid push. Then it's going underneath the rib cage, and it's basically getting as near to the subclavian veins, where the lymphatic system, when it picks up our fluid from our interstitial space, it cleans that fluid and then puts it back into the cardiovascular system right here. And that happens on the inside of the rib cage. So when we're moving it from section to section, interstitial fluid in the superficial space, then all we're doing is moving it into a location where it's less pressurized, and we can hopefully have the lymphatic system pick it back up and put it back into our cardiovascular system. We're really just changing the pressure in one particular zone or area so that it can work properly. Another question you might get is how often or how soon should I have this done? And that really depends, again, on the question of how long will it last. If it's something that you have identified as this is a therapy session, this is something that we're probably going to be able to, in this one session, our goal is to just get you breathing better so that you can sleep at night. If the goal is to get some sort of range of motion from a paralyzed person to get a range of motion with their arm, or maybe with somebody with dupuytren's contracture to actually be able to open and close their hands. It might be something that you know already is going to take a constant week after week therapy for a certain period of time. Those with lymphedema and those sorts of things, those are probably going to take several therapy sessions in order to get a handle on it. Those you should know, you should already know ahead of time how often. Maybe they can come in every day, especially if it's something dealing with life risks, risk of falling or breathing risks, respiratory problems, things like that. We've had clients that came in every day until, we've had a client that was down to 86% oxygen level, but within one session, that was already back up to about 95, 96%. So you can expect to gain quite a bit within one session, but again, your goal for one type of session is 100% resolution in that session. Part of Healer Logic is to know when it's going to be a therapy session, and knowing the difference between those. And knowing those is going to really determine how often can you come back. We do not have any minimum amount of time that they have to wait. We feel that we're there as well, using the tuning forks hour after hour each day, and other than maybe some repetitive stress and some your hands getting taxed and overused, that vibration is really not doing anything more than riding on a riding lawnmower or riding in a vehicle. So we do not think that there's like a minimum amount of time. They can come in, they can have double sessions, they can come in every day if they want. We've had clients come in every day. So there may be some times where the body itself just needs time to get rid of some of the fluids you may have moved. There might have been certain sessions that you do where you just need time. If you're moving toxins and you're working on neuropathy in the feet and the legs, you probably want to give it a couple of days for the systems to start back up again, or to relieve the toxins and the elimination system to work on its own. So those should be considered as well as part of Healer Logic. Again, I want to point out the fact that that we're born with perfect fascia, except for maybe there might be a birth defect or something like that. But as far as the fascia goes, your fascia is created in a certain way so that you're in a fetal position, and then throughout your childhood, your fascia will realign itself so that you go from being a baby and crawling and trying to lift your head up. As you try those things, your fascia actually changes itself over time until eventually your fascia realigns itself so that you can be upright and stand and walk and run and jump and do those things. So it is a thing that you should keep in mind, that that fascia will mess up over time. We do things to our fascia. We injure ourselves whether we can see it or not. You walk by a coffee table and you bump up against it. Usually we know if the front of our shin bone has taken a blow because we can feel the notches in our shin. But we don't know if we bumped up against something and maybe it hurts right away and we say ow, and maybe there's a bruise on there or there's slight bruising. Well, guess what? Your fascia underneath that has been damaged even though you don't see it. And maybe within a couple of hours, then you're not feeling it anymore and you just go about your day and go about your life. Well, what's happening underneath the skin where you've bumped up against something, you actually caused the fascia to do something different. whether it's an adhesion. When I say adhesion, I mean that these fibers that are oriented a certain way, they may have bent, they may have, we call that cleaving. So when a fascia fiber has, and I usually use this banana here to, because I can form it. Let's say this is a fascia fiber, and you can actually have a cleaving event. It's kind of like a straw, a plastic straw that may have been bent, and then you'll get a crease across it, and it's a permanent thing. So when your fascia gets cleaved or bent or broken, it stays that way. It's not like it can be combed out. Sometimes we think that we can do manual manipulation with our hands, but we can kind of start to unravel some of these birds' nests, but it really is there permanently unless you can do something to tell the controlling fibroblast cells to get rid of that section. It's no longer needed. What ends up happening is the fascia, the fibroblasts, realize that there still needs to be tension across this snarled area, and all it does is just lay down more stuff and pull even harder. So there's this inability for us to resolve fascial restrictions, to resolve these problems that happen underneath the skin. We get scars all the time, and we think that we might not see a scar anymore, or there might be slight scarring on the surface. What's happening underneath the surface is even worse, and it really does stay like that for the rest of your life, and it could get worse and worse and worse, and eventually you become aware of it when your lifestyle changes, when the things you eat change, when you're sedentary a little bit more, your work changes, and again, you're sedentary, and the fluids start to fill up. Where that scar underneath your skin was not that big of a deal, now it becomes the dam causing the water or the fluids in the interstitial space to kind of get compartmentalized, and it's harder and harder for fluids to move through them naturally.